everyone. My name is Sofia Perez Paredes, and today I will be analyzing the portrayal of schizophrenia in the movie A Beautiful Mind, starring Russell Crowe as Josh Nash. John Nash. This film tells a true story of Nash's journey through his battle with schizophrenia, his struggles with treatment, and his quest for acceptance and understanding. I'll discuss how the movie portrays the illness, how accurate it is, and treatments involved. John is shown to struggle with schizophrenia through his vivid hallucinations and delusions. For instance, he begins to see and interact with characters who aren't real, like his roommate Charles, a student at Princeton, and a young girl named Marcy. Nash also becomes deeply paranoid, believing that he is involved in secret government missions like decoding messages for a covert agency. One example is when he gets involved in a suspicious mission involving agents trying to uncover Soviet spies. This behavior and perceptions are classic signs of schizophrenia and highlights how the disorder distorts his reality. At first, the film doesn't directly mention Nash's condition, but his symptoms become increasingly alarming. His hallucinations and delusions cause him to lose touch with reality. In a moment, Nash has a breakdown after failing to follow through on an important mission, and he is hospitalized. It is here that he is formally diagnosed with schizophrenia. A doctor explains that he is experiencing a severe and persistent mental illness, which aligns with schizophrenia. This diagnosis comes after Nash is seen exhibiting erratic behavior and emotional instability, which are symptoms often present with this disorder. According to the DSM-5, schizophrenia is diagnosed when someone experiences two or more of the following symptoms: delusions, hallucinations, disorganized speech, and disorganized behavior. John exhibits all of these. For example, his delusions of being part of a secret government operation and his belief that he is decoding military messages fit the criteria for delusions. His hallucinations, like seeing his imaginary roommate Charles and the young girl, also meet the requirements for hallucination. Additionally, his dysfunction is clear. His career is definitely affected. He isolates himself socially, and his relationships deteriorate. All of these are signs of schizophrenia, and they fit the criteria. Yes, John meets all the criteria for schizophrenia. He experiences persistent delusions, like when he believes he is involved in a government operation. He also has vivid hallucinations, such as the imaginary roommate Charles and the young girl. These hallucinations are so real to John that they affect his daily functioning, causing him to behave erratically and isolate from others. His professional life is also suffered, as his research at Princeton and his ability to focus are deeply impacted. This all aligns with the criteria for schizophrenia, which is why his diagnosis is so accurate in the film. One of the areas that one area where the movie is accurate in showing how powerful and disoriented Nash's hallucinations are, for example, is when he is convinced that a professor from a Pentagon is recruiting him for secret work. It is clear that this is delusional thinking, and the movie also accurately portrays the difficulty of maintaining relationships and a career while living with schizophrenia, especially as John's illness creates distance between him and his wife, Alicia. However, the movie does oversimplify his treatment and recovery. By the end, Nash appears to overcome his illness and live a productive life without medication, which is not typical in reality. Most people with schizophrenia require lifelong treatment to manage symptoms, so this aspect of the film may mislead audience into thinking recovery is always that straightforward. In A Beautiful Mind, John initially receives antipsychotic medication and goes through therapy as prescribed by his doctor. These treatments are designed to help manage his hallucination and delusions. However, after experiencing severe side effects from the medication, like feeling numb and disconnected, John decides to stop taking the pills. He refuses further medication and tries to manage his symptoms on his own, which is a real challenge for people with schizophrenia. The movie does not go into details about his ongoing treatment after this, but it suggests that John's ability to manage his symptoms improve as he learns to ignore the hallucinations and live with them. While John's story focuses on his personal decisions to avoid medication, there are other important treatments for schizophrenia that could benefit. Cognitive behavioral therapy, CBT, is one approach that helps people challenge delusional thinking and develop coping strategies. Support groups are also valuable as they provide people with schizophrenia a space to share their experiences and strategies for managing symptoms. Additionally, family therapy could help John and his wife understand his illness and navigate the challenges of their relationship. Resources like SAMHSA National Helpline or NAMI help programs would help with providing ongoing support for John and his family. An occupational therapy treatment plan for John could include helping him regain his independence and improve daily living skills, like managing finance or cooking, which were affected by his illness. Since social interactions were difficult for him, OT could also focus on helping him reestablish positive social relationships and communication skills. Another crucial intervention could be teaching him coping strategies and managing stress and his hallucinations, which could help him lead a more functional life while minimizing the impact of his symptoms. There are several safety concerns when treating someone like Nash. First, due to his hallucinations, there could be a risk of self-harm or harming others. For instance, if he believes someone was a threat, it could lead to a violent behavior. Secondary, John's refusal to take medication can result in dangerous side effects, such as weight gain or fatigue, that might impact his overall health. Lastly, it's important to monitor for signs of relapse, as stopping medication can cause his symptoms to return. Ensuring that John has ongoing support from his doctors and families would be essential for his safety. In A Beautiful Mind, schizophrenia is sometimes portrayed in a way that might reinforce the stigma around it. For example, John's hallucinations and delusions make him seem dangerous and unpredictable at times, which is common stereotype in films. While not all people with schizophrenia are violent, this portrayal could unintentionally make audience fearful of people with this condition. And these are my resources. Thank you so much for watching.